Hi, my name is Jeanette.
Hi, I'm Sharon,
And I am Vince.
and we have Lynn's case. So, for the first question, the frame of reference we will be using is the biomechanical frame of reference. Lynn shows limited range of motion due to the tightness in her forearm and shoulder. However, her impairments can be improved by working on range of motion, strength, endurance, and functional abilities.
So the two ranges of motion that we would expect to be impaired and that we would assess first would be shoulder movements and forearm movements. So due to stiffness in her shoulder and forearm, we will focus on the horizontal adduction and supination to help her with the occupation she struggles with. She mentioned that she struggles with preparing a meal and putting on a bra. And for example, when she's cooking on a stove, her forearm supinates when she's frying a pan. And when she puts on a bra, she reaches her opposite shoulder to put on a strap. And when she washes herself, she also reaches to the opposite side of her arm and her chest.
Given a situation where Lynn shows pain when measuring internal rotation, we would proceed and try it again slowly to take precautions. We would make sure to let her know to tell us when there is pain again. We would proceed because Lynn's pain was resolved after taking a break.
Okay, and lastly, the two decreased ranges of motion that we expect to have the most impact on Lynn are internal rotation and supination. The reason for this is because the ranges were much lower than the normal range. Her internal rotation range was 0 to 5 degrees compared to the normal range of 0 to 60, and her range for supination was 0 to 15 degrees compared to the normal range of 0 to 90. And because she expressed that she struggles with bathing and preparing a meal, we believe that these two motions are valued in her occupations.
Hi Sharon, so this is the tool that we're going to be using to measure Lynn, and this tool is what we're going to do to measure her external rotation. So this motion involves her lifting her arm and her elbow at 90 degrees, and ask her to move her arm back. The axis, so this is the axis. This will be placed at the elbow.
So like this?
Yeah, like this. Good.
Okay.
Yeah, 90-degree angle. Good job. And then the axis will be placed on her elbow, and the stationary arm is the one that doesn't move, and this will stay in place while the moving arm follows her forearm. Okay. So the standard range for this is 0 to 80 degrees. Anything lower or above 5 degrees is a typical range, but anything that's not within that range, we would have to adjust it to her and let her know that we will work on it. Okay. So external rotation is what helps to shampoo your hair, and also involves with tying your hair, and then also ask her if she has any pain before you measure her or after measuring her. Okay, so I'm just going to show you real quick what we're going to do. So this is the axis. Okay, 90 degree, good, and then we're going to be placing it at the elbow. Remember, this is a stationary arm. This is what stays. Okay, and then this arm is what moves, and this is what's going to follow your forearm. Okay,
So like this?
yes.
Okay.
Perfect. Okay, so we're going to do that movement again. Ready? And I'm going to follow 3, 2, and 1. Good. Okay, so we're going to check. Can you check where you're at?
81.
81. So is that within typical range or not?
Yes.
Yes, good job. Yeah. So you're going to let the patient know that it is within typical range, okay? Okay, you're doing really good, and let me know if you have any questions.
Okay.
Okay? Okay, sounds good. Hi, so my name's Jeanette, and I'm going to be your occupational therapist. This is Sharon. She is an occupational therapy student, and I'm just going to be watching her, and she's going to directly work on you, if that's okay with you.
Yes.
Yeah? Okay, sounds good. Okay.
All right, I'm gonna take a seat. Hi, Lynn.
Hi.
Okay, so I'm Sharon. I'm gonna be taking up the measurement in your shoulder movement. Okay, are you in any pain?
Yes.
Okay.
So before you just get started with that, you can ask how much pain she is on a scale of 1 to 10, okay?
Okay. On a scale of 1 to 10, how much pain are you?
I'd say about 4 or 5 around that range.
Okay. Okay. So the movement I'm gonna be measuring is gonna be in your left shoulder.
Okay.
So can you rotate your head? Okay. Is it okay for me to find where I need to put my tool?
Yes.
I wonder your elbow. On your elbow? Okay. Okay. Can you lift your arm? Your arm. Okay, a little. Okay, good. And so on the elbow. Okay, and then can you move your arm back? Okay, is that the farthest you can go?
Yeah, it's
Okay, you can relax. Okay, so it is from 0 to 59. So that is less five, less than 580. Yeah. So it's
so
less.
it's less, so that wouldn't be in a typical range. Because remember, for that it would be 0 to 80 is a typical range. So since it's 59, it's less than 5 degrees lower than that. So you can,
Okay.
yeah.
Okay. Thank you. Hi, Vinny.
Hi.
Okay, so we have a client named Lynn, and we're gonna take a look at the motion in her elbow. Okay, so this is the tool we're gonna use. This is a goniometer, and basically you're gonna place this where the little hole is. We're gonna put it where we call the axis, which is right at the crease of her elbow.
Okay.
Okay, so you're gonna have her rest her arm down on the side of her body. You'll be putting this arm, which we call the stationary arm, it doesn't move. So you put this one on the upper arm part,
Okay.
and the moving arm, which is this one, is going to go where her forearm is. All right. And as she moves and bends, you're going to move the moving arm with her.
With okay.
Yeah. So the range we're trying to go for is 0 to 150.
0 to 150.
Anything below or under 10 degrees would be considered out of range.
Okay.
Okay, so this is the move that we use to, drink a cup from a cup of water.
Okay.
Do you have any questions for me?
No, I don't think so.
Okay, perfect. Oh, one more thing. Make sure to ask if she's in pain.
Okay.
Ask her how much pain she is, if she is,
Okay.
on a scale of 1 to 10. And make sure you ask if you can touch her before you do.
Okay.
Hi, Lynn. Hi. I'm Sharon. I'm an occupational therapist.
Hi, Sharon.
Nice to meet you. This is Vinny. He's gonna be he's a student, an occupational therapy student.
Hi, Vinny.
And he's gonna be taking a look at the measurements in the elbow movements.
Sounds good.
Sorry, all over them. Hi.
Hi.
Okay, so I'm a student, and I'm gonna be go ahead measuring your elbow, the way you bend it.
Okay,
Okay.
sounds
I'm gonna
good.
use this
Okay.
to go ahead and make the measurement.
Okay.
Is it okay if I touch and find the spots where I can go ahead and find the measurement?
Yeah, go for it.
Okay. So I'm gonna go ahead and be right here. Okay. Can you extend your elbow for me? All the way down?
Extend.
Down? All the way? Good. Okay, now go ahead and bend. There you go.
Okay.
Good.
Sounds good.
Okay. All right, so we are at a 50. A 0 through 50.
It would be on
Oh,
this
I'm
side.
sorry. Actually, this is 0 through 130, and this is not in the normal range.
I'm gonna ask her if she's in pain.
Do you have any pain?
I currently do not have any pain.
Okay. No pain at all.
No pain at all.
Okay, good. All right, I think that's going to be it for now.
Sounds good.
Okay.
Okay. All right.
Hi, Janet. What we'll be doing today is going to be measuring Lynn's left wrist,
Okay.
wrist extension.
Okay.
Okay. Remember to ask the client if they have any pain,
Okay.
1 out of 10.
Okay.
Ask if it's okay to place your hand before you even touch the client.
Okay.
Okay. There might be some discomfort when you're doing the pain, when they're doing the movement, but as long as it's not excruciating pain, she should be okay.
Okay.
Okay. So you want to find the access point, and so you're gonna find the access point right in here.
Okay.
Okay. And then you're gonna use the goniometer,
Okay.
and you're gonna place it right there. Okay. And then you're gonna ask the client to fold the wrist.
Mm-hmm.
So go ahead and fold the wrist.
Extend it or flex it?
That's yeah. Go ahead. Yeah, that way. You're gonna want to fold it that way. There
Okay.
you go.
Okay.
And then you're gonna follow this
Mm-hmm.
to the first finger.
Uh-huh.
And then you're gonna tell them to relax.
Okay.
Okay. All right. So that's what you want to do.
Mm-hmm.
And then from there, you're gonna go ahead and let them know that the standard range of motion is 0 to 70.
Mm-hmm.
If they fall in within that range, then you want to let them know. If she is limited, which she might be because she is having pain,
Mm-hmm.
then you want to let her know what was her readings.
Okay.
Okay, and if she is not within the normal range of motion,
Mm-hmm.
she does have limitations,
Mhm.
and you can let her know that that's something that we can work on the next visit.
Okay. Sounds
Yeah.
good.
Okay.
All right. Thank you.
You're welcome. Hi, Lynn.
Hi.
My name is Vince, and I'm the occupational therapist.
My name's Jeanette. I believe the occupational therapy student.
So she's gonna go ahead and do some measurements for you, okay? All right. Are you okay with that?
Yeah, I'm okay with that.
Okay.
Okay, sounds good. Lynn, I'm gonna need your left hand, and I want you to place it right here on the table. Okay? Okay. Yeah. And then, so before I go, do you have any pain? No. No. Okay. Sounds good. All right. I'm gonna be measuring this. Okay. I'm gonna just, if you don't mind, I'm sorry.
Make sure you ask her.
Yeah.
Okay.
Is it okay if I put my hands? No. Okay. Okay. I'm so sorry about that. And now I would want you to extend as furthest as you can, okay? Are you okay? It kind of hurts. Okay, I'll stop right now. I'm so sorry about that. How would you describe that pain? It's pretty painful. Pretty painful? Okay. Do you feel like we can continue with this or no? Should we come another day?
That's okay. I just can't go too far.
Okay, too far? Okay, that's totally fine. Okay, so you are at 16 degrees. So that's not the typical range we're looking for. The typical range for us is 0 to 70. So we're gonna work on this and try to make sure you're gonna be on the typical range, okay?
What is this measurement for?
So
This
you
is-
wanna let her know.
Okay.
Do you know something that she can use it for?
Okay. So wrist extension. This is gonna help you to comb your hair, right? So we want to be able to help you get back to having your self care. So that's what it's gonna be. Yeah. So is there any other questions that you have? No. No? Okay. Sounds good. Thank you so much for cooperating with us, and I know you're in a lot of pain, but we'll try our best to accommodate to that.
Hi, Sharon. What we'll be doing today is measuring Lynn's left forearm. Remember to ask the client if they have any pain and to rate it 1 out of 10. Ask if it's okay to place your hands on her forearm to continue with the procedure. So what you want to first do is find that access point. Okay? So you're going to have her put her elbow right next to her arm, just like this. Okay? And then you're going to place the goniometer right on her wrist joint. Okay? And you're going to have her turn her hand this way. Okay? And then you're going to measure. Okay? That's what you want to do.
So how much is it supposed to bend?
Okay, so your bend is supposed to be from 0 to 90 degrees. Okay, so that's your normal range of motion. Obviously, she has some injuries, and she's very possible she's not going to reach that. Okay, so you just want to take a note that, but you want to proceed with not too much pain. And then, so what occupation is this important for? You know, so one important occupation this motion is important for is for twisting a knob. So to open doors, you know, use that. Okay. Okay. So that's what you're gonna have to do with Lynn. Do you feel comfortable with that?
Yeah, I think so.
Do you have any other questions that I can help you with?
No.
Yeah. Okay. Let's go on and meet Lynn. Hi, Lynn.
Hi.
My name is Vince,
Hi.
and I'm the occupational therapist. Okay. And this is Sharon.
Hi.
She is a student. She's gonna be taking your measurements today.
Okay.
Is that okay?
Yeah, that sounds good.
So I'm gonna take a seat right here. Okay, so we're gonna look at the movement in your forearm in your left side.
Okay.
So I'm gonna have you actually put your arm tucked in at a 90 degree. Perfect. Is it okay if I touch your wrist to see where you point?
Go for it.
Okay. Okay. So, like this. Okay, and then can you twist your arm as much as you can?
Oh, that really hurt.
Of your pain.
Yes, that really hurts.
How much pain, like on a scale of 1 to 10?
I would say 8.
Okay. So your range is from 0 to 20. Oh, sorry, no. 0 to 65. So that would be not in the right?
Right.
Okay. Okay, and then so this is the movement usually you use to open a doorknob.
Okay.
Do you feel pain when you open a doorknob?
I do.
Okay.
Yeah.
Okay. Do you have any questions for us?
No, I don't.
Okay.
Okay, thank you.
Hi, Jeanette.
Hi.
So we'll be measuring our client Lynn's movement in the
Okay.
finger on her left hand.
Okay.
Make sure to ask if she's in pain and
Mhm.
how much pain she's currently in on a
Okay.
scale of 1 to 10.
Okay.
Okay. So the movement I want you to measure is called MCP or metacarpal phalangeal
Okay.
joint
Mhm.
extension.
Okay.
So this is where MCP is, right at the
Mhm.
knuckle.
Okay.
And so I'm gonna have you have her hand on the table
Okay.
and make a bear claw.
Make a bear claw. Okay.
So this is the stationary side or
Uh-huh.
stationary arm.
Uh-huh.
So you're gonna place this at 0
Okay.
first.
Got it.
And then you're gonna place this on the back of her hand this
Okay.
way.
Uh-huh.
Okay, and then the little hole will be on the axis, which is where the knuckle is.
Okay, sounds good.
And then you're gonna, when you have her do the extension,
Mhm.
move this little narrow arm called
Okay.
the moving arm,
Okay.
and bend it together, and it should be flush on the back of the hand.
Sounds
like this,
good.
Okay.
All right.
And you'll take a look. It'll be the typical range
Yeah.
for MCP extension is
Yeah.
0 to 45.
Okay.
Yeah, and this is usually the movement we take. This is the movement we use when we're washing our hair or typing.
Okay, sounds good.
Okay, do you have any questions for me?
I do not.
Okay. Oh, one last thing. Make sure you ask before you take the measurement to touch her hand.
Okay, got it. Sounds good.
That's
Thank
it.
you.
Are you ready to meet Lynn?
Yes, I am.
Awesome.
Okay, awesome.
Hi, Lynn. My name is Sharon.
Hi.
Hi. So I'm an occupational therapist, and this is Jeanette, and she's an occupational therapy student.
Hi.
She'll be taking the measurement in your fingers.
Okay, so I'm gonna be taking your measurement on your knuckle today, on your left hand. So please let me know if there's any pain while doing so.
Okay.
So you don't have any pain on your knuckle, do you?
There's some pain.
There's
yes.
some pain.
Yes.
Okay. So how would you rate that pain?
About 4 or 5.
4 or 5?
Yeah.
Okay, so I'm gonna go ahead and take my measurement. Is it okay if I put my hands in the
Yes.
tool here? Okay. So also, please let me know if there's any pain when I'm taking your measurement, okay?
Okay.
Okay, sounds good. So I'm gonna place it right here. And so can you please put your put your fist in a bear claw like this? This sounds good. It's good. Thank you. Alright.
So you want to start here.
Uh-huh.
So you start here. Make sure it's flush with the finger
Zero.
all the way down. And then ask if she can go further from there.
Okay. Can you further? Extend it.
There you go. Yeah. Right there.
That
Okay.
hurts. Yeah.
Oh, I'm so sorry for that. Okay. So you're at what happened?
It kind of hurts.
Okay, I'm really sorry about that. So you're at around like 15, 0 to 15.
Okay.
This isn't within the typical range, but that's okay. That's the reason why we're here. We're gonna be here to support you and help you and get it back within that the typical range, okay?
Yeah, because it's painful.
Yeah.
It hurts.
Yeah, so that's the thing. Like when you're taking a shower, it probably hurts, right?
Yes.
Yeah. So when you're taking a shower, we want this. Like we don't want the pain to be there while you're showering.
Okay.
So this is the reason why we took this measurement. Okay.
Okay.
So do you have any other further questions or anything we can do to support you?
No.
No.
Yeah.
Sounds good. All right.